Hello future doctors, welcome to Anatomy Ki Duniya. I am Himanshu Bijlani, doing MBBS first year from Jawaharlal Nehru Medical College, Ajmer. So today we will covering the second part of the clavicle, uh, including the attachments, clinical anatomy and the ossification of clavicle. So let's start. Okay, so let me first revise all the important landmarks that were discussed in the last video. So this was the lateral end of the clavicle, which is also known as the acromial end. This one was the medial end of the clavicle, which is also known as the sternal end. Coming to the inferior part or the inferior surface of the clavicle, this one was the conoid tubercle, a rounded protuberance present on the inferior surface of the clavicle. This one was the trapezoid line, a linear elevation. This one is also known as the trapezoid bridge also. So this one is the linear elevation present on the inferior surface of the clavicle. This one was the subclavian groove. This one was the costal tuberosity or the this one is the costal tuberosity, which is an impression for the costoclavicular ligament. The shaft is further divided into two parts, the lateral 1/3 and the medial 2/3. You can see two curves here. Okay, so now we will discuss the attachments, ossification and clinical anatomy of the clavicle. So now coming to the attachments of the clavicle. At the lateral end, the margin of the articular surface of for its acromioclavicular joint gives attachment to joint capsule. The medial end, the margin of the articular surface for the sternum gives attachment to first the fibrous capsule of the sternoclavicular joint all around, the articular disc posterior superiorly, the interclavicular ligament superiorly. On the lateral 1/3 of the shaft, the anterior border gives origin to the deltoid muscle. The posterior border provides insertion to the trapezius muscle. The conoid tubercle and trapezoid ridge gives attachment to the conoid and the trapezoid parts of the coracoclavicular ligament. Okay, so now you can easily visualize that the of the acromioclavicular joint. See the point where the anterior point is written here in the diagram is the acromioclavicular joint. It is present on the lateral end of the clavicle and which give attachment to the joint capsule. So now from this diagram you can easily visualize the sternoclavicular ligament and which is present on the medial side of the clavicle. So this diagram shows the interclavicular ligament. The yellow one is the interclavicular ligament. The red one is the anterior sternoclavicular ligament. So this one is the trapezius muscle. This one is the deltoid muscle, which originate from the anterior surface of the clavicle. Let me just remove these muscles. See, you can easily visualize this. Let me remove this muscle also. See, this one is the anterior surface of the clavicle. This one is the deltoid muscle, which originates from the anterior surface of the clavicle. So the deltoid has basically three heads of origin. First one is the clavicle, second one is the acromial process of the sternum, and third one is the spinous process of the sternum. See, this one is the deltoid muscle. Now coming to the trapezius muscle. This one is the trapezius muscle, which is inserted on the posterior border of the clavicle. See, this one is inserted on the posterior border of the clavicle. So the ligament which is underlined by red line is the coracoclavicular ligament. It consists of two parts, the trapezoid and the conoid. The trapezoid attaches with the trapezoid ridge and conoid attaches with the conoid tubercle. On medial two-thirds of the shaft, the most of the anterior surface gives origin to the pectoralis major. Half of the rough superior surface gives origin to the clavicular head of the sternocleidomastoid muscle. The oval impression on the inferior surface at the medial end gives attachment to the costoclavicular ligament. The oval impression was the costal tuberosity, which I had discussed earlier. The subclavian groove gives insertion to the subclavius muscle. The margins of the groove give attachment to the clavicopectoral fascia. The posterior surface close to the medial end gives origin to the sternohyoid muscle. So let me first show you all the origin and insertion of muscles in the 2D diagram, and later on I will also show you these muscles in 3D view also. So the blue one, all the blue marks are indicate that these muscles have their insertion in this bone, and all the red marks are indicating that they have their origin in these points. So trapezius muscle have the insertion on the posterior end of this clavicle. The deltoid originates from the anterior surface of the clavicle. The sternocleidomastoid also originates from the posterior side of the medial side of the posterior surface. The pectoralis major, which covers the most of the anterior part of this bone. The subclavius muscle, which is inserted on the subclavian groove. The costoclavicular ligament, which is present on the costal tuberosity. There is a coracoclavicular ligament which has two parts. First one is the trapezoid and second one is the conoid part, which are inserted on the trapezoid line and on the conoid tubercle. So now we will discuss all the muscles which have origin or insertion on the medial two-thirds of the shaft of the clavicle. So basically most of the anterior region is covered by the pectoralis major. This one is the pectoralis major. See this. It covers most of the anterior part of the medial two-thirds part of the clavicle. Now this one is the let me remove this. This one is the sternocleidomastoid muscle, which we will discuss in the head and neck volume. It has two origins. One is the one head originates from the clavicle and one head originates from the sternum. See, the name indicates sterno and clado, means one head from the sternum and one head from the clavicle. Okay, so now we will discuss the insertion of the subclavian muscle. This one is the subclavian muscle, which insert on the subclavian groove. It originates from the costal cartilage of the first rib and it is inserted onto the subclavian groove, which is present on the inferior surface of the clavicle. See, this one is the clavipectoral fascia or the deep fascia of the pectoral region of the body. You can easily visualize this. It is a transparent sheet-like structure present on the pectoral region of the body. So now coming to the ossification of the clavicle. So in the last video I have given you some of the tasks, that what are the primary centers and secondary centers, and there are how many primary and secondary centers are present in the clavicle. So let us discuss here. the clavicle is the first bone in the body to ossify. So this is a very important point to remember, that the clavicle is the first bone to ossify in our body, except for its medial end, which ossifies in a membrane. See, in the last video I have discussed that what does this line mean, that the bone ossifies from the membrane. So I'm again repeating that this means that the bone does not ossify directly from the cartilage, it ossifies from the connective tissue. It ossifies from two primary centers and one secondary center. See, these are the two primary centers, and this one is the secondary center, which is present on the sternal end. Now, what are the primary and the secondary centers? So, primary center is the first area of bone to start ossifying, which usually appears during the prenatal life, while the secondary centers are the area of ossification that appears after the primary ossification center has appeared clearly. So the two primary centers appears in the shaft between the 5th and the 6th weeks of intrauterine life and fuse about the 45th day. The secondary center for the medial end appears during the 15 to 17 years and fuses with the shaft during 21 to 22 years. Occasionally, there may be a secondary center for the acromial end. So now coming to the clinical anatomy of the clavicle. The clavicle is commonly fractured by falling on the outstretched hand or the indirect violence. The most common site of fracture is the junction between the two curvature of the bone, which is the weakest point. Seen in 3D view, I told you that there are two curvatures of the clavicle. The junction of the two curvature is the weakest point of the clavicle. The lateral fragment is displaced downwards by the weight of the upper limb, as trapezius muscle alone is unable to support the weight of the upper limb. See this diagram. This one is the trapezius muscle. When there is a fracture on the junction of the two curvatures, the upper limb due to gravity will move downwards, and the posterior surface of the clavicle is attached to the trapezius muscle, which is the only muscle to hold this part, while this part, the medial part, is held by the sternocleidomastoid muscle. Now coming to second clinical anatomy. The clavicles may be congenitally absent or imperfectly developed in a disease called the cleidocranial dystosis. Now what is dystosis? It is a defective in the formation of the bone. In this condition, the shoulders droop and can be approximated anteriorly in front of the chest. So now this is what happens when there is cleidocranial dystosis. There is no clavicle bone present in our body. See this in the X-ray, you can see that there is no presence of clavicle here. Okay, so that's all for today. For today's task is you have to tell me that what is the origin and insertion of the muscle, of the two main muscles that are the deltoid and the pectoralis major. For today's homework, you have to just go through all the important landmarks, all the attachments and clinical anatomy of the clavicle. So I hope you like my video. In the first part, I have covered all the landmarks, and in the second part, I have covered all the attachments and clinical anatomy and ossification of the clavicle. So please do subscribe my channel and share it with all your friends and with all the future doctors. Thank you.